Hi, I'm Chris from Registered Osteopaths, and today I'd like to talk to you a little bit about headaches. A lot of people are unaware that headaches commonly have mechanical causes, often down to tension in the neck. Now, so this is the spine, this is the base of the skull called the occiput, and these yellow things here are the nerves coming out between the spinal cord. The red tissue here is actually the blood vessels in the upper part of the neck. Now, the muscles in the back of the neck running along beside the vertebra here can become quite tight for a multitude of reasons, and this can include posture at work. If you carry your head slightly forwards and crane your head when you're looking at the computer screen, that leads to these muscles becoming very tight. If you're in any kind of accident, a car crash or anything like that, that can also do it. Sometimes just being stressed also makes you quite tense in the shoulders as well. Now, this muscle tension can lead to headaches in a variety of ways. Firstly, the muscles connecting up to the base of the head here, they are going to pull down on that tissue there, and there's a lot of connective tissue and membrane basically covering the back of the skull. If those muscles are pulling down quite firmly on that, what that can do is that can lead to the feeling like your head's in a vice. It's called a tension headache. It's very uncomfortable, and it's down to that tension down on the base of the skull. Another form of headache that's very, very similar in the mechanism but feels quite different is called a cervicogenic headache. And that's where these nerves that are coming out between the vertebrae here are compressed by the muscles as they leave. That leads to a feeling behind the eye, up towards the top of the head, quite painful sometimes. And that's because these nerves are being stimulated halfway along their length on the way back into the spine. And that's, again, down to these muscle tensions in the neck. The third type of headache that we commonly see here is migraine headaches. Now, migraines have many different causes. There's many factors to those causes as well, and sometimes that's food, sometimes it's stress triggers, sometimes there's a huge multitude. On the other hand, what we've found is that there's often a mechanical component, and releasing up that tension can free up the blood vessels and the nerves in the neck that can actually help quite dramatically with migraine headaches and reduce the incidence of them. So basically, at City Osteopaths, what we do is check to see the mobility through the vertebra in the neck, check to see the tension in the muscle tissues and the membranes and the connective tissues, and then we try and use some gentle manipulative techniques to try and loosen those up, remove the cause of the irritation in the neck, and then often helping dramatically with the headaches. A lot of people are surprised by how quickly we can actually remove the headache. Well, thank you for listening.